What is the worst physical pain you have ever experienced? Story 1. About 14 years ago, I decided to get my tonsils out. My ENT noticed how closed up my sinus passages were, and before the surgery asked if I'd like them opened up as well. Sure, let's get it all done. Recovery was okay. About 3 months later, I started getting a headache. Within 24 hours, I was pretty much immobilized from the pain and kept a warm compress over my eyes to keep the light out. I went back to my specialist. He said, "You have a migraine," and prescribed Vicodin and Percocet. When that didn't do anything to help the pain, even doubling the dose, I called my ENT back. He said go to the ER, but in that tone that says, "You big baby." They stuck something in my arm. I passed out and woke up feeling great. Next morning, I looked like someone punched me in the eye. Went back to my ENT and he showed me the scan they took in the ER. I had such a severe sinus infection, I was fit to burst. He was very apologetic for basically brushing off my concern. I had something lodged in my sinuses and had a ridiculously bad sinus infection as well just about 4 months ago. It was so bad that I was draining cerebrospinal fluid from my nose for 2 weeks. Sinus infections suck already, but a really severe one is insane. It literally feels like your head is going to split in half. Sometimes, I had thought my eyes popped out of the sockets from the pressure. This reminded me of my tonsillectomy nightmare. I also had a tonsillectomy and an adenoidectomy as an adult, and had a different but also terrible time. About a week after the surgery, I woke up from a nap in terrible pain and with really intense nausea, and before I could make it to the bathroom, I started vomiting blood. I proceeded to wander around feeling faint and vomiting blood. I was pretty out of it and clearly not thinking totally straight, until my dad came out and saw what was happening and took me to the ER. I'm grateful and lucky I was staying with my parents for the recovery. Long story short, the site had reopened and was bleeding while I slept, and the blood had been draining into my stomach until I woke up from the pain and nausea. I ended up having emergency surgery to repair it. My mom cleaned up the house before I came back home from the hospital, but she told me it looked like quite a crime scene. Yeah, doctors can't show any weakness. The moment they admit any kind of mistake is the moment they open themselves up to a lawsuit. Story 2. An infection resulting from a tumor in the marrow of my jawbone split it open along its length, like an overripe fruit. It was approximately how it sounded. Odd silver lining, I always TMJ issues on the right-hand side that were somehow 99% resolved by all the surgical fucking around and bone shifting involved in the treatment route. It took a long time for all of my movement and comfort to resolve, but the penny dropped one day and I just went, hang on, that's fixed now? Hey, I had the same thing happen to me, except it was my right femur. So not the exact same, but basically the tumor got so big my femur just shattered. They said my bone was eggshell thick when I woke up from surgery. The whole story was, when I was 10, I had complained about my pains, but they just assumed it was growing pains, which it absolutely was, but with a little extra spice. At first, they had no idea what to do with me, since basically my entire femur was in pieces. They tried several different forms of traction before settling on drilling through my knee and suspending my bent leg from my hospital bed, so my thigh was straight up. I was like that for 64 days. My only mobility was sitting up. After that, I was in a spica cast that went from my chest to my ankle on my right leg, then to my knee on the left so that I could bend that. I was in that for another couple months, then basically had to relearn how to walk. I was supposed to go in every year or so for x-rays. Did that for a while, then put it off until my sports physical for tennis in 10th grade. I remember thinking, hey, I haven't had an x-ray in a while. We should probably schedule one. Went and got the x-ray. Doctor immediately scheduled an MRI for the next day. Orthopedic surgeon comes into my room holding crutches saying, "Get off that leg now. Tumor is back in full force." One of the options they were considering when I was 10 was a titanium rod to help set the bone, but since I was growing, I would need a new rod like every 6 months. But now my growth plates have closed, so it's time. Emergency surgery 2 days after the MRI. They cut me open, cut open the bone, eggshell thick again. They couldn't believe it hadn't broken again, and scraped out all the tumor. I ended up using all the donor bones they had at the hospital. This time turnaround was much quicker, a couple of weeks tops, but now I'm the owner of a giant titanium rod that's 13 inches long, goes into the head of my femur, and it's held on by 10 lag bolts. It gets sore when the barometric pressure rises or drops, but otherwise I'm fine. 50 years ago, I probably wouldn't have had a leg, or just straight up would be dead. 20 years on, and my ortho still parades me around the office when I visit like, hey, remember that kid with a tumor 20 years ago? This is him. I was a bit of a medical anomaly, and all the surgeons involved loved talking about it. One of the only perks of being in a younger generation is the possibility of getting to have robot arms when I'm 80. Story 3. I am one of a small percentage of people who, when quickly detoxing from heroin, actually came close to dying. Alcohol and benzodiazepines are typically the two substances that kill people when they try to quit suddenly. Heroin just feels like you're going to die, but 99% of the time people don't. In 2011, after many attempts, I finally gave up on the stuff and hid myself away in my apartment. About 12 to 18 hours in, I got all the usual symptoms. Within about a day, I had a headache so bad I could barely walk. About 36 hours in, the headache had turned into what I can only describe as someone taking a wide-gauge knitting needle and shoving it through the back of my skull and swishing it around my brain. I got hot white spots in my vision that would expand and contract with the pain levels, and as they expanded, I went blind. I lost a bunch of motor function, and the only thing I could do is scream bloody murder, and I actually peed myself as I crawled to the front door of my apartment. My neighbors, thinking I was being assaulted or worse, called the police, and they arrived pretty quickly, and I told them everything. Was rushed to a local hospital and went through a bunch of tests. They discovered that my brain was bleeding from acute opioid withdrawal. The silver lining to that is it allowed me to be qualified for medical detox, which is something typically only reserved for alcohol and benzos in my area. So yeah, definitely the worst pain ever. If I had a gun in my hand at the moment, I would have been fully prepared to end it all given the level of pain. 12 years later and many struggles, I am about 10 years free from opiates, and almost 3 from everything else. Sobriety is a gift. I once had to detox from opioids, benzodiazepines, alcohol, muscle relaxers, and barbiturates, all at once. It was so painful that I dissociated completely, and only I recall the experience in third person. I'm a cop, and during my extensive time on the force have witnessed up close the debilitating effects of addiction and withdrawal. The fact that you endured such pain and suffering and still managed to break the cycle speaks volumes of your character. I think I'm someone of a strong character, but I could never survive what you went through. Detoxing from sugar nearly broke me. Story 4. Having an ovarian cyst burst your fallopian tube feels a bit like your behind exploded, although it's terrifying because you don't really know what the pain is at the time. I've had 2 kids also. That sounds agonizing. Even without the burst fallopian tube, a cyst the size of an extra-large egg bursting is by far currently number 1 the worst pain on my list. I've had multiple cysts burst, but one I had last year caused a torsion of my ovary. Basically, the cyst weighs down your ovary and makes it twist, cutting off blood supply to the ovary. Dropped me straight to the ground when it happened. The human body is science fiction. Fight me. Story 5. The day before I started first grade, I accidentally sliced a deep cut through my hand that nearly severed my pinky entirely. I actually didn't even register it right away because the knife cut through the nerve on that side of the hand. The worst part wasn't the cut itself, but sticking my hand in the disinfecting solution in the ER was a feeling similar to my entire hand being set on fire. Had a very similar one, probably only a year younger than you too, was swinging on the TV cabinet despite being told not to very many times, and the whole thing inevitably fell forward. It was an old TV, one that had slightly raised rims around the screen. Somehow I managed to fall backwards and only have my hand get hit by the falling TV. My pinky took the worst of it and nearly severed it. I remember standing up crying and seeing the blood shooting out. Also, like you, no permanent damage, although I can't do the Star Trek gesture with that hand, but I can with the other. I assume that's why. I sliced my finger open recently. My very sharp pocket knife came open in my pocket on its own, somehow, and my finger got filleted the next time I reached into my pocket. I was driving at the same time, too. It didn't really hurt, I just thought I poked my cuticle on my knife's pocket clip. I pulled my hand out of my pocket and shook it the way you do when you stub a finger or something, and blood sprayed everywhere. I ended up having to go to the hospital and get 5 sutures. The only part that really hurt was the needle they used to give me a numbing agent before doing the stitches, and the knowledge that the Kershaw Knife Company had stolen 3 hours from my weekend and painted my car interior red. I was working a factory job and a big metal cart came up behind me and sliced my ankle. It was a clean cut, but about a half an inch from my Achilles Achilles tendon. It was more of a shock than anything. A really cool feeling. I ended up with 8 stitches and a cool scar. The corporation screwed me on the workman's comp. Story 6. I had abdominal surgery for cancer 10 years ago. There is a scar that goes from my crotch to just below my sternum where they took all my guts out, extracted the tumors, and put my guts back in. About 8 hours after the surgery, pumped full of drugs, I decided to go for a walk. I used the bed control to seat myself upright, used my IV dolly as a support to get out of bed, then carefully, like a bent-over geriatric, shuffled my way to the door. See, the trick was to support myself as much as possible with my lower back and keep my abdomen out of it, and it worked for a few steps until the vertigo hit me. I lurched forward and tensed, and then I felt my intestines settle, the hemispheres of my abdomen strain against the internal stitches. The two halves sort of float independently, and every layer of skin rips against the staples. I basically got to feel a nice little sample of evisceration, and there was no amount of narcotic numbness that could stop pain that deep. Truly, I empathize with William Wallace. It wasn't fun, so I threw up blood, which didn't feel nice, shuffled my way back to bed, and hit the drug button. Not quite as bad as this, but I had abdominal surgery and had to sneeze the day after. The fear of knowing how much pain I was about to be in, then the sneezing and searing pain where my incisions were, then the dull ache that replaced it was the worst 20 seconds of pain and agony I've ever felt. My mom had this surgery last year for an appendix cancer that spewed cancer onto all her surrounding organs. It was a 14-hour surgery. She had just had a bone marrow transplant to treat her leukemia 2 hours prior and said she'd rather do that again than to try to heal from that surgery. The good news is that she did heal, save for getting a fistula where her ileostomy bag was attached. So glad she's doing well. What a strong woman. I honestly feel like, in a lot of these cases, women are stronger than men. Story 7. Kidney stone. It took 74 hours to pass, and it was excruciating the whole time. Same here. The pain was so bad I was throwing up until I had nothing left. Then I was dry heaving and shaking. The stone wasn't passing, so I was about to have the laser surgery to break it up. They told me to go to the bathroom one last time before they put me under anesthesia so that I don't urinate during the procedure. So I go to the bathroom, it finally passes. And what I tell people is that it felt like I shot a full-sized ninja star out of my body. I woke up on the floor with blood all around me because I passed out passing it. I had a 4mm stone, found it in June through a CT scan after blood and urine, otherwise had no pain. I didn't pass it until September. One day, on the way home from work, it started its journey from my kidney to my bladder, which was the worst part, like 13 out of 10 on the pain scale. Cold sweats, nausea, excruciating pain, had to go to the ER. Once they got the pain under control, I ended up passing the stone 4 or 5 days later and was like a 2 out of 10 on the pain scale. More ouch. Oh, there we are. All better. I swear most of the pain of a kidney stone is in the name. If they called it a kidney gumdrop, it wouldn't be half as bad. Story 8. Healing from my first, second, and third degree burns. I got bad second-degree burns on my hand, was driven to urgent care with my hand in ice water because that was the only thing that made the pain bearable. The night nurse came in after sorta looking at the burn, got me some painkillers and said, "We're gonna have to have that dry off before we can figure out what's next." That was the worst pain I have felt. Ended up getting a giant hand-sized blister on the back of my hand, at least 1.5 inches tall. Grossest feeling when I felt it pop and run down my arm one day as I brushed my teeth. Surgeon here that did a lot of burns in training. Little to no classic pain with 3rd or 4th degree burns since the nerves are gone. That being said, I saved a guy that had 80% 3rd degree burns, maybe a record for all I know, and the day he left the hospital after almost a year, we had a big party. He went home and killed himself. The psychological toll of big burns, especially to the face, cannot be understated. Wait, there are 4th degree burns? Please excuse my ignorance. I've been really burned out. Story 9. Bone marrow biopsy. If you ever have to have one, just accept that it's gonna suck. I used to answer this question with kidney stones, but that bone marrow biopsy was horrible. The needle part to get the marrow wasn't terrible. It was the bone core chunk that rendered me useless. I was in too much pain to even swear. Worst part is, I know another one is coming soon, but this time I asked to be sedated. Otherwise, it's not gonna happen. This is my answer too. I know my brain is lying to me about how bad it was, and my memory of it is still of absolute agony. I know I was drenched in sweat afterwards. They let my wife come in and hold my hand, and I came close to crushing her fingers. I wish they could just knock you out for it. Later that day, I had a liver biopsy that was very painful too, but was a picnic after the bone marrow one. My girlfriend had to have a couple of those, and afterwards I buy her a nice dinner and roses. Story 10. Herniated disc in my lower back, 3 months of sciatica. Went through this horror for 3 months and then got a discectomy 2 weeks ago. Instant relief. I was up and walking the same day. A bit of soreness now 2 weeks later, but all the scary thoughts are gone. Oh yes, same thing. 3 months of hell, bedridden, unable to walk more than 20 steps at a time, 30 minutes of sleep for almost a week at the height of the pain, nearly losing my sanity during the process. I never knew a person could feel that level of pain. I was begging for relief. Both of my poor parents have gone through this. Surgeries, therapy, medication. Nothing seems to help some people, and of course, it's genetic. I'm not exactly looking forward to it happening to me. Story 11. Trigeminal neuralgia. It's very hard to describe TN to people that don't have it, but I think this is probably my best way of describing it. The anesthetic injection that's administered by your dentist often feels like an electric bolt going up your nose into your eye socket. Well, imagine this pain starting anywhere in your gums, mouth or tongue, or teeth when traveling through your cheekbone and out of your head over and over again for minutes at a time before subsiding for anything from a minute to minutes, leaving an intense burning and throbbing, pins and needles sensation before it begins all over again. It's relentless. Same. According to Google, it's nicknamed the suicide disease because it is so painful, one of the worst pains known to man. It's hard to explain to people, like when the pain comes, I stop existing. There is no me, no body, no world, no experiencer, only pain. And when it happens, I sit completely still, drooling, and my eyes and nose running, totally silent and motionless, shut down like I'm a dying animal. And then that happens over and over and over. Getting TN traumatized me. I no longer feel like this body belongs to me. It belongs to the pain. I don't feel safe in this body or world. It's very hard to get people to understand the effects. Since it's not a visible disease, people think I over-exaggerate the symptoms. I've had it for over 10 years, and my parents still think I'm just overly sensitive, and it's from me not taking good care of my teeth. It's easier to just deal with it in silence than to have people judge me and think I'm being a big baby. Dear God, this sounds like something out of a Saw movie. Story 12. This will no doubt pale in comparison to the entries here. It was a gas pain. Started around 10 p.m. and I couldn't shake it. I tried everything. It just got worse and worse. I started having problems breathing. It was so damn painful, every breath was like a stab wound internally. As a grown man, I was whimpering and just debilitated. Around 2:30 a.m., my roommate brought me to the hospital and I ended up passing gas literally outside of the hospital. And like that, I felt relief. I've broken bones before and I've also had gas pain before. But this one time was the worst physical pain I felt, like my guts were twisting and someone was stabbing them with a hot knife. Doctor here, I sometimes get gas pains. They can bring you to your knees. Movements that slowly contort the stomach can help mobilize them towards the exit faster, is a good idea. For me, it really helps that I recognize this pain and can check for other signs of dangerous illness. Still not very fun though. Figuring out which foods, drinks, spices, eating intervals cause them, and going for a walk after a meal helps prevent them. Most people do not realize how severe gas pains can actually be. My wife and I both have experienced the really awful kind, and both of us have agreed it was hands down the worst, most debilitating pain either of us have ever felt, like a 9.9 out of 10. It made my worst ever gout flare-up seem like a stubbed toe in comparison, especially if it's the first time you've experienced it. The first time I was really constipated, I had no idea what was happening and thought I was dying. Story 13. Tooth abscess. Imagine someone taking a red-hot nail and hammering it into your gums. Each heartbeat is another hit of the hammer, and Florida will not hand out pain medication for them. You just have to suffer while antibiotics kick in over a week. This is what I came here to say. I could barely sleep, eat, or drink for days. I actually told myself that if this goes on for much longer, I can't handle it. I've heard women who have given birth without drugs say an abscess is more painful. This is the one. I had the tooth pulled. It had already had a root canal, but they placed the crown poorly, so it abscessed. Mine happened at Christmas, so I suffered for a couple of days waiting for the dentist to open. I barely slept. Honestly, I just sat there and cried for hours on end last night. I went to the dentist and they numbed me. I almost fell asleep right then. It was bliss, just not hurting. I thought I would be upset about the $1,200 I spent on the root canal and crown being thrown away, but I was too relieved to care. Anything involving teeth is terrifying. There's a reason that scene in Marathon Man, where a dentist tortures Dustin Hoffman, is so effective. Story 14. Having my eye removed. It was horrible. It really didn't hurt until the next morning. Then it burnt, stung, and hurt, but it didn't last long. In order to get a replacement, I had to go to Pittsburgh for an 8-hour appointment, where they went through a bunch of things to make it fit correctly. Then, the man I went to had actually hand-painted my eye. The worst part of it was managing the loss of my eye, trying to be able to judge distances and so on. Eye pain for me as well. In 2018, I slept in my contacts and developed an extremely aggressive infection. Could have easily lost my eye. Still need to get a cornea transplant if I ever want to see clearly through my right eye. Pain was a kaleidoscope of burning, stabbing, pressure headaches, and extreme light sensitivity. Like a white paper in a dark room was like looking at the sun sensitive. Spent 45 days of daily doctor visits. I was then able to fly home. Another 45 days and doctor visits before I could withstand daylight with my old lady sunglasses on. I can't comment on your specific situation exactly, but a relative of mine lost complete vision in one of their eyes, as well as partial loss in the good eye in an opportunist street robbery. This was years ago, but they have suffered every day since. Despite many specialist operations, stem cell research, and treatments, they couldn't do anything to restore the vision, but were at the very least able to avoid removing the eye. Although every day they have to administer various types of eye drops, some of which are extremely specialist and ludicrously expensive, although thankfully covered by our healthcare system. Due to partial vision loss in the good eye and no vision in the other, the good eye is constantly overworked and straining. They can no longer drive at night because the glare from headlights became unbearable. Depth perception is a constant challenge. Due to the strain they suffer, migraines much more frequently, and vision/capability has only become worse as time has gone on. The value of the robbery in question was very low. They'd have handed it over in an instant without any hesitation, but they say that there is no amount of money that could replace the quality of life lost. This was years ago, and there have been huge advances in medical science, which may have been more effective back then. But there is always the possibility a surgery doesn't help, or even makes things worse. Again, without knowing your exact situation, location, or healthcare practice, I would advise you do everything you can for your cornea transplant. You only get one set of eyes, and the sooner you can sort it, the better it will be. I don't know if there's any particular time window to act in regarding the surgery in your case, and I know if you are in the States, it would probably be very expensive. But if it's possible, do it sooner rather than later. You'll gain so much quality of life back in your future. That is horrible. Not only the physical pain, but the psychological turmoil of it. That's something often overlooked with different forms of pain, especially when it results in loss of vision or hearing. Story 15. Testicular torsion. It is as painful as it sounds. Imagine someone kicking you directly in the testicles and continuing to kick you again every other minute. And if a doctor doesn't perform a surgery within a few hours, you lose your testicle. Torsion happens randomly and cannot be really prevented, usually to teens but also adults. If ever you have a persistent and very sharp testicular or lower abdomen pain, seemingly out of nowhere, for me it was during a normal morning after breakfast, don't wait around more than an hour and go straight to emergency. It's usually due to a deformity, commonly known as a bell clapper deformity. The testicle normally is partially connected to the scrotum, keeping it in place. With a bell clapper deformity, it's not connected completely, allowing it to twist inside the scrotum, leading to torsion. I didn't have torsion, but I did have epididymis. It's an infection. Basically, one testicle went from ping pong ball size to apricot or small tangerine in roughly 5 hours. The other tried to keep up and went to a small plum. That walk from the doctor to the pharmacy and back to the car to drive 2 minutes home, I spent about 5 days laying in a fever, unable to move, and trying not to move. It was so bad I had 2 rounds of antibiotics. I understand that it's pretty rare to have that happen, so fast and so extensive. Not fun, but a great story. I'm so glad it's 9 a.m. and not 2 a.m. when I usually read these things. Story 16. I have endometriosis. My pain sometimes is so bad that I will beg my husband to knock me out, or I'll punch my legs because it somehow makes less painful in my pelvis if I inflict pain somewhere else. I've had 4 major surgeries in 10 years and will likely need 1 more at some point. Some people think it's just painful periods, but it's not. I've been fully disabled 24/7 by the pain and other symptoms for years at a time. Because it is a female disease, no one really does much research on it, even though 10% of the female population has it. I have been pre-diagnosed with it, and the pain is absolutely insane. I was in pain for 3 days straight, taking Tylenols, which didn't do much. I felt like my insides were collapsing. I had to go to the emergency after the 3rd day, and the nurses put me in the wait room and forgot about me. I feel like I'm so used to my periods being so awful that I sit there and take it. When I saw my doctor after that, I straight up asked him to just remove my uterus. If I can't get pregnant, then what's the point of enduring this pain? I'm still waiting to see a specialist and get diagnosed properly. I'm both shocked and not surprised how far down I had to scroll to find someone saying this. For me, it's stabbing pains in my abdomen, lower back, hips, and upper thighs. Sometimes so bad I pass out or vomit, can't eat, drink, or move. And yet doctors still don't seem to take it seriously enough. I wish men and more doctors understood how bad it gets. I'm curious as to what your husband says when you ask him to knock you out. Has he ever obliged? Story 17. Gout. In any joint. I've had it in my ankle, big toe, knee, and hand. I couldn't put a first prize ribbon on any of them. Absolutely awful conditions that I wouldn't wish on anyone. Gout is the one, and people who have never had it have no comprehension of how bad it hurts. I once read a poll involving women who had natural childbirth and gout at some point in their lives. Roughly half of them said gout was worse, and not just by a little bit. Came here for the gout comments. On my first episode, it wasn't just my big toe, it was my entire right leg. And on that first night, I thought I must have broken something, and I was looking forward to having them see the entire leg off. It hurt so bad, I knew it had to be removed. I went through multiple doctors who didn't really know what they were doing and didn't necessarily trust the gout diagnosis. They would put me on a week's prescription of colchicine, which helped immediately. But then, of course, the gout would come back and in different places: toes and ankles and knees and hands. Finally, after nearly a year, I got in with an actual rheumatologist who put me on allopurinol, long-term, and colchicine for short-term acute flare-ups. It's all under control now, but I still have to watch for those unexplained pains in the joints that indicate I should take a few days of colchicine. What a hilarious name for such a terrible condition. Story 18. Ingrowing toenail on my big toe in high school. Was really hoping it would fix itself and let it get worse and worse over quite some time. Eventually went to the GP, who said he had a great solution, showing me a piece of a Bic pen where he cut through one side, creating a C-shaped little tube, about half a centimeter long. He grabbed my foot, held it near the nail, and before I had registered what was about to happen, he said, "Someone's gonna scream," and jammed it on my toe, through the flesh. I was not able to sit still for an hour and had to keep moving around, or the pain would be too overwhelming. It helped and the toe healed, but never again. I had such a bad ingrown toenail that a podiatrist recommended the surgery where they remove your entire nail and then kill the nail matrix so it will never grow back. I was like, okay, how does that work? Is it inpatient, hospital, what? He said, no, just wait here, I'll be right back. He froze it up and then said, can you feel this? I said, no. He said, well, if you didn't feel that, you won't feel the rest of the surgery. Then held up my gory dripping toenail in a pair of what looked like pliers. I was like, holy crap, what if I could have felt that though? I came here to say this. I had an ingrown toenail when I was younger too. Worst pain I've ever experienced was when I accidentally bashed it off a table. It was so sore that my body went into shock, and it took a couple of seconds for the pain to actually register. Could barely walk for a good while after it. A friend once had an ingrown toenail removed and then forced me to look at the photo of what was removed. I am still in trauma therapy. Story 19. 2-day-long migraine. I seriously considered killing myself. Did pass out at least a couple of times. A pressurized glass bottle exploded in front of me, and a tiny shard of glass went straight into my eye and popped it. So basically my eyeball was leaking. They stitched my cornea back together, and later my retina fell off, which is common when the eye loses pressure, I guess. I have some vision there, but I'm basically blind in that eye and can only see large objects in some peripherals. Let me tell ya, it sucked. Eye surgeries and needles in your eyeball are a nightmare. Protect your eyeballs always, kids. My kid accidentally hit me in the eye with a cardboard tube she was playing with, and my entry for most pain ever was the resulting scratched cornea. I had to be driven to the ER, and it was all I could do to essentially hyperventilate the whole way while avoiding screaming. Freezing drops stopped the pain within seconds though. I can't even think of what a pierced or ruptured eye would feel like. That sounds like hell. I hope you pressed charges against her immediately, as that's a serious assault. Thanks for watching all the way to the end. If you have a similar story that you would like to share with us, please leave it in the comments below. If you enjoyed this video, please leave us a like and subscribe if you haven't done so yet. It really helps grow our channel. For more videos like this one right now, please click on one at the end of the video on the screen or stop by our channel. Thanks again, and see you next time.